Choosing the right pair of shoes to buy when you have flat feet could sometimes be a task. Pain is usually associated with flat feet, especially if you are engaging in rigorous physical activities or if you are standing up for too long. Your foot arch is formed by metatarsal and tarsal bones, and it helps your feet to absorb shock when it bears the body weight. When you are engaging in an exercise or a physical activity such as walking, running, or even standing, the arch on your feet helps to reduce the impact of the force on your hips, knees, ankles, and feet. There are different arch heights. It could be low, high, normal, or none at all. People whose arch do not exist are considered to have flat feet and can experience pain on their feet, ankles, and hips after physical activity. What type of shoes should you wear for flat feet? Flat feet could be managed, and the accompanied pain reduced, by wearing shoes that are comfortable, cushion the effect of body weight on the feet, and provide arch and heel support. A podiatrist might recommend custom orthotics or arch support insoles that you can insert into your shoes. If you have flat feet, it is a clever idea to be quite cautious when making choices for footwear. The main objective of choosing the right footwear for your flat feet is to provide arch support, cushion the heels, and reduce pronation, turning inwards, of the ankles. Shoes for flat feet are designed with support for the ankles, heels, arch, and has enough space for the toes. There are 3 types of shoes suitable for people with flat feet. They are: 1. Stability shoes. People with normal arched feet has a straight landing on their feet when they move. When people with flat feet walk or run, their feet tend to pronate, turn inwards near their ankles. This puts a lot of pressure on the feet, ankles, and knees and leads to pain and discomfort. Stability control shoes can help to manage this pronation and reduce the pressure on the ankles. Most working and running shoes for flat feet are usually stability control shoes. 2. Support shoes. It is not a clever idea to wear shoes without arch support. High heels and sandals do not offer arch support and therefore is not always recommended. However, there are some arch support inserts that can be used on sandals, flip-flops, and low heels that do not originally have an arch support system. These arch supports are designed to perform functions that the arches would have performed if they were present in the feet. 3. Motion control shoes. For severe flat feet cases, especially those accompanied by pain, motion control shoes are highly recommended. They are designed to offer more feet control and arch support than stability shoes. They ensure that the pronation of the flat feet towards the inner ankles are corrected. This is achieved by the double-density foam added to the insides of the shoes. This foam is injected right onto the arch resting region and all the way to the heel. Some shoes display this dense foam as a gray area in the insides or midsole of the shoes. They play a vital role in helping the feet to absorb shock and also reduce the effects of the inward pronation of the flat feet on the ankles. What is flat foot? Flat foot, also known as pes planus or fallen arches, is a foot condition that makes the arch of the feet to become flat, causing the whole area of the foot to touch the ground when standing. Although it occurs in about 30% of the world population, it does not show any symptoms and cause no pain or discomfort to most people. For some people, their flat feet condition is accompanied by mild discomfort and pain that could worsen after standing for a while, running, or engaging in any physical activity. Flat feet and its accompanied pain can be managed by physical therapy and exercise, the use of orthotic insoles, and the use of suitable footwear. Some flat feet caused by deformity of the foot bones or muscles can be treated with surgery if the pain felt is becoming unbearable. It is therefore a clever idea to find out the causes of your flat feet so that you can properly figure out the best option to use in tackling it. Let us look at the potential causes of flat feet. What are the causes of flat feet? Flat foot is present in adults and children alike. In fact, it is quite common in infants and children. Most children have flexible arches that flatten when the stand and curves when the body is not bearing weight. This type of flat feet usually develops into normal arches as the child grows and matures. In adults, rigid flat feet are usually present and are acquired either by heredity or other factors such as 1. Excessive weight gain. 2. Injuries lead to torn tendons and muscle damage. 3. Prolonged rigorous physical activities such as jumping or running. 4. Wearing poorly fitted and high-heel shoes. 5. Diabetes. 6. Cerebral palsy. 7. Stroke. 8. Rheumatoid arthritis. 9. Pregnancy. 10. Obesity. 11. Aging. How can flat feet be treated? The main symptom of flat feet is pain on the feet, ankles, knees, and hips due to poor shock absorption by the fallen arches. The impact of the body weight on the feet is poorly absorbed and is thus transferred to the knees and hips and lower back. This force puts pressure on these body parts and causes a change in gait and posture. Flat feet therefore could bring about ligament and tendon damage, hip and back pain, arthritis, plantar fasciitis, inflammation of the plantar fascia, and other foot disorders. Treatment of flat feet and other conditions accompanied by it depends on the cause and how severe the symptoms are. Some of the methods used in the treatment of flat feet are pain medications, ice compression of swollen and painful areas, foot exercises, foot therapy, and the use of over-the-counter or prescribed orthotic insoles. If the flat feet are caused by muscle or bone damage and the symptoms are quite severe, surgery might be used to treat it. Did you find this video helpful? Let us know in the comment section below. Do not forget to visit our site, www.zimhairlosshelp.com for more hair care content like this. Thank you for watching.